Hello, everyone, and welcome to our session. Thank you very much for joining. We will start our session in a few minutes while other members are joining the session. Thank you very much for joining. Hello, welcome to our session. Thank you for joining. While we are waiting our colleague to continue joining, we'll start our session in the few minutes to come. Okay, thank you. Thank you very much for waiting. Thank you for joining us for our today's Path Live Forum entitled Funding Digital Health Transformation. And we are going to see how countries are guiding smarter investments. And my name is Neema Ringo. I am a technical lead for policy and governance under the Center of Digital and Data Excellence at PATH, and I will be moderating our today's conversation. Before I introduce our panelists, I would like to share a few logistical details for our event today. First, I'm very excited to announce that our today's conversation features live French interpretation for our French-speaking colleague. And in order to access the interpretation feature through Zoom, you must have the latest version of Zoom client. And if you are using the web browser, sorry, the Zoom will not work. The interpretation function will not work. And during the session, we also want to hear from you. Please engage with us and feel free to share your thoughts, questions, and experience over the next hour. And in fact, in the few minutes, I'd like to start by asking all of you at least to tell us which city are you tuning in from today. And please type your answer in the chat box and send the answer to all panelists as well as attendees. And we will appreciate if you also comment on the answers through the chat box. Please know that this session is being recorded and will distribute for those who are unable to join our session today. So our session is going to be recorded. I also want to say a special thank to Amazon Web Services, or AWS, for their sponsorship support of this event. And over the next 3 years, AWS is committing 40 USD million to harness the power of the cloud to advance health equity globally. And Amazon Web Services is offering AWS promotion credit and technical expertise to selected institutions and companies addressing health disparities that impact underserved and underrepresented communities around the world. And the program will support applications that increase access to health services, but also applications that intend to reduce disparities by addressing social determinants of health, and also applications that intend to leverage data to promote equitable and inclusive system of care. And to apply to this opportunity, please visit the URL that is on the screen. I think everybody can see the screen. And the deadline for this application is on December 15th, 2021. And finally, I want to thank you all for joining us from all over the world. Philanthropists, government representatives, corporate partners, and peers. We really appreciate your interest and participation in our today's, as we all work together to advance global health equity. And now tuning to our speakers, we are honored to be joined by incredible group of people. And with us today, we have Dr. Ernest Mbor, Digital Advisor to the Ministry of Health in the Democratic Republic of Congo. But also we are privileged to be joined by Mr. Macha, Tumaineli Macha, from the Ministry of Health, Tanzania, under the Department of Policy and Planning, and he's the Director for Monitoring and Evaluation. But also, we are excited to be joined by our own lady, Ms. Danielle Mullin, a partnership and campaign officer from Transform Health. Thank you very much, our great panelists, for joining us. So before we engage with our speaker, I'd like to share a bit background about our today's conversation. This event is part of our first Digital Health Week, an opportunity to share the evolving story of digital health across sectors, technologies, nations, and regions, all in the effort to advance digital transformation and achieve universal health coverage. This conversation will bring together critical components of digital transformation, government leadership, and investment. Without these components, digital health will not be sustainable or scalable, and will not meet the needs of citizens and communities. And with this background, PATH has partnered with government of Tanzania as well as Democratic Republic of Congo to create a national roadmap for digital health investment, and with the organization like Transform Health to advocate for country-led transformation. And our today's panel bring together just few perspectives from this work, but I am eager to hear more about the global community and how global community can continue supporting government and the communities as they expand their digital health system. And with that, I would like to dive into today's discussion. And as we proceed, I'd like to start by talking about country-led investment roadmap or investment cases. can support sustainable digital transformation. And maybe I'll start with our panelist, Mr. Macha. Hello, Mr. Macha. Thank you for joining our session. I know Tanzania has recently updated its digital health investment roadmap, and we'd like to hear what have you learned through this process and how has Tanzania investment roadmap helped to align partners and donors? Please welcome Mr. Macha.
Thank you very much, Neema, for inviting me in this very good forum, which we are going to share our experience on area of digital investment, especially in the third world countries. And as you have already mentioned, that my name is Tumaini Macha. I'm Director of Monitoring and Evaluation at the Ministry of Health, who responsible for ensuring the availability of health data for decision making. We know, all of us, we know that in order to get good and the quality data for decision making, we need to make an investment in digitalization. So on the side of Tanzania, we decide to first to prepare the digitalization strategy, which inform where we want to reach on the area of digitalization, what we intend to do in the period of 5 years. Then after developing that digital strategy, we say, okay, we have this digital strategy. How are we going to get the fund to implement or to execute to execute our dreams? So we sit down with as a government team with other partner and start developing an investment roadmap. That investment roadmap draw some of the all intervention which we have planned to implement in our digital strategy, and the costed one. So we cost all the investment and prepare that investment roadmap. And during preparation of that investment roadmap, the major areas which we are looking is to plan which we should start first. In other words, to prioritize which we should start first and which will continue after building the foundation. So during that preparation, during that period of developing the digital investment roadmap, we learn a lot, because what we were developing, what we decided at the investment strategy, when we come in the area of costing, we learn that some areas should make many modification, and some area we need to prioritize more. Some areas we need to left them behind because we need to left them. So those are the things which we learn when we are preparing the investment roadmap. But after having our first investment roadmap, that was a very good tool which we use to convince partner, to ask for partner to join our hands so that we can improve in the area of digitalization. So the investment roadmap helped us very much to mobilize fund in area of digitalization in Tanzania. An example, in a first investment roadmap, we were having almost 70 to, I mean, we have having a number of intervention, but up to the time we review that roadmap, we were able to implement almost more than 20 interventions, which were in that investment roadmap. And then, I mean, in those 20 interventions, we are financed by different partners in implementing it. So what I can advise is having a roadmap, a investment roadmap, especially in a digitalization, it helps very much to bring partners together because they see where you are going, what is your focus, they see what your expected output, and they see the cost of those expected outputs. So that one I can contribute on benefits which we experiencing during the preparation of that digital investment roadmap, implementing the first digital investment roadmap, but also right now we have already reviewed our second digital investment roadmap, and we see how partner they are coming up so that they can help us to invest in that in digitalization in Tanzania. Neema, over to you.
Thank you very much, Mr. Macha from Tanzania Ministry of Health. And that is such a great experience. And we have noticed that you had many priorities, but later on you decided to prioritize and come into fewer priorities, and later on sell the investment to partners and manage to secure resources to make sure that the investment roadmap is implemented. That is a very great experience. Thank you for sharing that. Now, going to Democratic Republic of Congo, Dr. Mbo, I know you have just begun to develop your digital health investment roadmap and using inclusive and collaborative process. How is the Ministry of Health engaging partners, and what are you hoping to achieve during this process? Welcome, Dr. Mbo.
Merci beaucoup. Je pense qu'il y a la traduction qui va assurer. Je vais parler en français si vous permettez. Je me permets d'abord de remercier Pat pour cette opportunité que vous me donnez de m'exprimer au nom de la République démocratique du Congo. Je suis Ernest Mbo, comme vous l'avez mentionné. Je suis conseiller en charge de santé numérique pour les ministres de la Santé publique, hygiène et prévention de la RDC. Tout d'abord, il faut que nous puissions profiter de l'occasion pour remercier l'organisation PAF pour
Dr.
son
Mbo,
apport.
Sorry, Dr. Mbo, we are still struggling to let our translator join in the call. He has not joined yet, and we will appreciate if you can respond into English, if you don't mind. Thank you for understanding.
Yeah, let me try to speak my best English. I wanted first to thank you for this opportunity.
And maybe if you don't mind, if we can proceed with Danielle while we are waiting for our translator to join. Is that okay? Or you want to proceed responding in English?
I don't know if Danielle can translate. I can speak in French, or if you can't, I can try to respond in French, in English, if you want.
Thank you very much.
English, you want?
Maybe I will proceed with Danielle while our translator is joining, then I will come back to you. Is that okay?
Danielle can translate?
We are still waiting for our translator to join. So I will go with Danielle while we are waiting our translator to join, and then I will come back to you.
Let me begin in English.
Yeah, Danielle, I know Transform Health, one of the organizations that you work with, is just beginning the development of global investment case for digital transformation. We just wanted to know how country priorities are reflected in this work, and how do you develop a global framework that is applicable to different contexts? Welcome.
All right, thank you so much for having me, and thank you for that lovely question. Just to give a person some background, Transform Health is a global coalition of many different organizations coming together with a joint purpose for advancing or progress towards universal health coverage through using digital health technologies. So that being said, we identified that there's no dedicated funding organization within the digital health ecosystem. And so what we're doing is developing a conceptual framework that kind of defines the rationale, positioning, scope, and approach for a full investment case. So we haven't reached that element yet of creating a full investment case, but we're creating the conceptual framework that would support the development of the full investment case. Now, that being said, the conceptual framework is looking at, adding to the existing tools and publications that we have and ensuring that we take an evidence-based approach. Now, what you asked specifically was, how do we ensure that we have national, and regional priorities maintained in the development of an investment case? And so what Transform Health is doing is actually creating a global research consortium that will then guide the development of the framework. And so that global research consortium will include lead regional research partners that will represent the various LMICs or lower middle income countries across the world, and also ensuring that we include the youth component. So we have a youth-led mapping and research exercise included as a part of it. So that whole Global Research Consortium is the main way in which we're ensuring that the various country level or country specific and regional specific interests are maintained. So we have, Eastern Southern Africa as one, Western Central Africa, Asia, the Middle East, Northern Africa, and Latin America. And in each of these regions, we're engaging a priority, or rather we have an organization that would be leading the charge in that sense. It's very similar to how Transform Health itself is modeled in the sense that we have national campaign platforms that are now being built out in the various regions. For example, we have in Indonesia, we also have another in Kenya, and they will be leading those country and regional specific priorities in those areas. So really and truly, everyone is coming together and working, but again, identifying that there will be slight differences based on where we're from and the current landscape within the countries and the regions that we live within. And so we're taking that approach of having the Global Research Consortium.
Thank you very much, Danielle, for sharing such a wonderful experience and also including youth in the entire process of developing the global framework. That is a great job. Maybe let me shift a bit and discuss how country leadership and digital health can help public health more inclusive. Mr. Macha, while Tanzania Digital Investment Roadmap focuses on investment in digital tools, the impact of this investment goes far beyond the digital health. How does Tanzania Digital Health Investment Roadmap support the country's broader health goals? Welcome, Mr. Macha.
Thank you again, Neema, for this opportunity. Let me go back a little bit back. Through this, digital investment roadmap, the government was able to achieve a lot in area of digitalization, but also in the area of outside the digitalization. Let me touch some few areas where we have benefited from digitalization. One is improvement of EMR through digitalization. I mean, through investment roadmap, we are able to improve our EMR in Tanzania. So, I mean, right now we have Afya Care, we have Gotomis, but also other medical record system. But also we were able to develop an enterprise architecture, which have been used much to improve our development and the layout of our digitalization systems. But also through investment roadmap, we are able to develop a client registry. We are also being able to integrate some of the system which were not talking each other, but through the roadmap, we prioritized to invest in those areas. But I mean, we were able to achieve those integration. That is the area of digitalization. But on the area of governance, we are able to bring together through investment roadmap, we are able to bring together the funders of area of digitalization, because we were having no tool for helping the government to bring together the funders or partners who are willing to finance the area of digitalization. That's one. But also through investment roadmap, we are able to strengthen our government dialogue in area of digitalization. In Tanzania, we are using swap mechanism in implementing health intervention, and through that swap, we have technical working groups, and one of the technical working group which were strengthened due to prioritization on a digital investment roadmap is ICT, M&D ICT technical working group. Through this technical working group, we are able to bring all partners together to discuss issues regarding the data, issues regarding the information systems, issue regarding with the interoperability, and so forth. So by bringing those partners together through the investment roadmap, we were able very much to improve in the area of governance in the health sector, especially in the area of digitalization. Let me end there, but I'll add if I've more on that.
Thank you very much, Mr. Macha. I've heard a number of digital intervention that is contributing to the improvement of health outcomes in Tanzania, and more specifically availability of data that is facilitating, informing or facilitating the improved health care services across the country. Now that our French translator has joined, I'd like to go back to Dr. Mbo, and maybe I rephrase, I repeat the question which I asked earlier. Dr. Mbo, if you can hear me, I know that the Democratic Republic of Congo has just begun the development of its digital health investment roadmap, and using an inclusive and collaborative approach. And we would like to know how the Ministry of Health is engaging partners, and what are you hoping to achieve during this process?
Merci beaucoup pour la parole et surtout l'opportunité que vous nous offrez. Je crois que nous devons d'abord commencer par remercier l'apport de PAF dans la transformation numérique du secteur santé en République démocratique du Congo, parce que c'est avec l'appui technique et financier des PAF que nous sommes engagés véritablement dans cette direction de la transformation numérique. C'est depuis 2017 que nous bénéficions de cet appui et nous avons eu quelques résultats, notamment la création de l'agence qui s'occupe du numérique dans le secteur santé. L'opportunité par rapport à cette feuille de route, je dirais que c'est inaubaine pour nous parce que ça nous permet, les pays a eu à élaborer non seulement un plan national du numérique avec la volonté politique actuelle qui pour nous c'est un moment idéal pour les pays à faire avancer cet agenda, mais également la création du ministère du numérique et qui nous permet aujourd'hui de penser que le moment est bienvenu pour véritablement avancer vers cette transformation numérique. Cependant, la stratégie du numérique qui a été élaborée l'année dernière a connu des petites difficultés pour être mise en œuvre. Ce n'est pas seulement lié à le fait que bon, c'était l'année où la pandémie à Covid a bouleversé un peu beaucoup de planification, mais surtout lié au fait qu'il n'y avait pas encore un alignement des différentes parties prenantes derrière cette vision stratégique du gouvernement qui est exprimée à travers ces plans stratégiques. Le cadre que nous a offert l'appui des PATS dans le cadre de ces processus d'élaboration de la feuille de route des investissements a été une opportunité non seulement pour le gouvernement, mais pour toutes les parties prenantes, de se mettre autour d'une même table afin d'identifier les vraies priorités de l'ère en matière de numérique dans le pays et d'essayer de les budgétiser. Et donc, comme vous l'avez mentionné, nous sommes dans ces processus. Et donc, l'un des points forts que nous pouvons mentionner aujourd'hui, c'est le fait qu'il ne nous a pas fallu beaucoup d'efforts pour arriver à réunir toutes les parties prenantes, notamment les bailleurs et les partenaires, mais également et surtout le secteur privé. Le secteur privé qui a répondu favorablement à cet appel du gouvernement et participe aujourd'hui de manière active avec toutes les parties prenantes dans les discussions autour de ces processus d'élaboration de la feuille de route que nous avons la lourde responsabilité de coordonner dans le pays. Et donc, je me représente, je suis Ernest Mbo, je coordonne non seulement ces processus d'élaboration de la feuille de route, mais je conseille également les ministres de la Santé en matière du numérique. Ces processus avancent bien, donc nous avons réussi à mobiliser toutes les parties prenantes, mais également il y a eu des points qui nécessitaient d'être clarifiés, et donc ces processus d'élaboration de la feuille de route a permis également au gouvernement, mais aussi à toutes les parties prenantes de clarifier le rôle et responsabilité des différents services du ministère. Parce que, comme j'ai mentionné tout à l'heure, l'agence en charge du numérique a été créée récemment. Mais il y a eu des services qui étaient en charge de certains aspects, de pilotage de certains aspects du numérique dans le secteur, où ça n'a pas été facile, surtout pour les acteurs en interne, mais également pour les bailleurs qui financent les interventions de santé numérique à travers le pays. De comprendre clairement le rôle des uns et des autres et c'est dans ce cadre ici de l'élaboration de cette feuille de route que nous avons eu à organiser des séances de travail afin de clarifier le rôle et responsabilité des différentes parties prenantes. Et je crois qu'aujourd'hui, avec l'expertise que nous a partagé les collègues de Tanzanie, je remercie M. Henry qui s'est déplacé pour nous accompagner. Nous sommes en train d'avancer aujourd'hui vers la finalisation de notre feuille de route qui a connu la participation active de toutes les parties prenantes. Et je crois que la semaine prochaine, on va commencer la budgétisation que nous avons des différents investissements qui ont été identifiés. Et donc, une fois de plus, nous vous disons merci pour cette opportunité. Merci.
Thank you very much, Dr. Mbo, and you're warmly welcome. Thank you very much for such an experience And Mr. Macha has heard that you'll take experience from Tanzania to improve what you are doing currently. Thank you very much. Yeah, now coming back to Daniela, you also sit in young experts and in tech health, which advocate for greater youth participation in the digital health transformation. And why is youth perspective so important, and how can we create space for greater youth engagement in the entire process of digital transformation?
So thank you so much for the question, Nima. I have this one quote that I always say at these events, and that's, we can't only pretend that youth are only the future. Youth are also the here and the now, and they affect the present realities that we're all living. And so when it comes to digital health and digital technology, I think there's no greater time than the present, as we're living through a pandemic that is affecting all our nations, all our countries in so many different ways. We need to find new ways to innovate, and we need to find ways that we can ensure we're using the same technological advancements that can bring us closer to our families and help us with social media, etc. How can we use those same advancements to now help us advance our progress towards universal health coverage? And so young people have to be included because, one, we're a part of the future, but also we're a part of the present. Where I think right now we have the largest youth demographic that we've had, especially here in the Caribbean, where I'm from. The youth demographic has never been this large. We make up a significant percentage of the overall population. And so when it comes to including young people, I always say that you have to include young people from the inception. One thing I've seen many organizations do is that the organization creates a plan, creates the overall outline, and then goes to young people and says, hey, what do you think about this? When young people should be included from the start. Ask them to reimagine the future. Ask them to, what can we do better? What are we currently missing? What are the needs of your demographic? Because the reality is young people can also be a part of creating that solution, right? And so once we have that kind of approach and mindset, which Transform Health does do in a sense, because all the various circles and key areas of focus within Transform Health have a youth representative. So as a young expert in tech for health, I represent the region of the Americas, particularly the Caribbean. And so I sit on the resource and investment circle. So we know this is a circle leading the conceptual framework for the investment case. There's a campaign circle, data policy, et cetera, et cetera. Young people are included in those day-to-day conversations. So that's what I would like to see, including young people from the start, asking them what they even think the needs and priorities are, and also allowing them to play a hand in developing solutions.
Wow. That is wonderful, and yeah, I can imagine engaging youth at the earliest stage can bring big impact for the future. Maybe let me finish my round with Dr. Moore. I know that DRC is large, big, and diverse. And how are you addressing the digital divide as you continue to strengthen the country digital health infrastructure? Welcome, Dr. Moore.
Merci beaucoup. Vous avez raison, en fait, la fracture numérique dans les pays, elle est importante. Mais cependant, il faut noter plusieurs opportunités que nous devons saisir aujourd'hui et qui nous fait penser que nous pouvons travailler évidemment maintenant pour essayer de réduire drastiquement cette fracture, mais également de faire avancer l'agenda du numérique en santé. Parmi les opportunités, je citerai cette volonté politique affichée par le chef de l'État aujourd'hui qui fait du numérique un levier pour le développement de la RDC, qui a bien voulu non seulement pousser le pays à élaborer un plan national du numérique, et c'est ce plan qui adresse la réduction drastique de cette fracture numérique à l'horizon 2030. C'est ainsi que le pays a mis en place, j'avais mentionné tout à l'heure, tout un ministère pour le numérique, afin de regarder évidemment comment réduire cette importante fracture à travers le pays. Et je crois que le ministère du numérique est en train de finaliser également une feuille de route pour la mise en œuvre du plan national du numérique. À côté de ça, pour nous, il y a des éléments importants qu'il faut noter que nous offre aujourd'hui ce cadre de discussion dans le processus d'élaboration de la feuille de route. C'est le fait que toutes les parties prenantes ont accepté d'adhérer à cette vision et de se mettre autour de la table. Et quand je dis toutes les parties prenantes, je fais allusion au secteur privé, mais également aux bailleurs et aux partenaires bilatéraux et multilatéraux. Ils sont convaincus qu'aujourd'hui, investir dans le numérique, c'est investir dans le développement durable. Et donc, pour nous, le processus d'élaboration de la feuille de route, c'est une grande opportunité qui nous permet aujourd'hui de regarder les choses en face, avec l'appui de la politique, mais également du ministère du numérique, avec qui nous travaillons en étroite collaboration, pour non seulement adresser ces questions importantes de la fracture numérique, mais également de voir comment nous pouvons aller progressivement vers l'amélioration ou la transformation numérique dans un pays assez vaste. Nous reconnaissons que les enjeux sont importants, que nous ne saurons pas tout faire en une année, mais nous sommes alignés dans un processus à moyen et à long terme. C'est ainsi que nous estimons réduire progressivement cette fracture et faire avancer l'agenda du numérique dans le secteur de la santé. Merci.
Thank you very much, Dr. Mbo, for such a wonderful response. As we thank you for responding to the question, and I want to go to our audience and take some few questions that our panelists can respond. But before I go to that session, I would like to acknowledge the presence of Dr. Mpoki, Tanzania previous permanent secretary who led the development of first digital investment roadmap. Dr. Mpoki, if you're around, will you please say a word, if you don't mind, before I take questions from the audience? I see he's not in the position to respond. Now let us go to our audience, and I will take few questions depending on the time until 10 minutes to 7. And we have one question: given the number of areas a country could focus, how do you prioritize areas of digital health for investment? And since Mr. Macha has gone to at least to a second digital investment roadmap, Macha, do you have anything to say on that? Given the number of areas a country could focus, how do you prioritize area for digital health investment?
Thank you very much, Neema, and the participant who asked that question. It's true that in the area of digitalization, there are numbers, a million areas for intervention. But as the country, we sit down and decide, what do we want first? The first thing which we, as the country, were interested on is to have a quality data. Now, if the outcome of digitalization is to having a quality data, we go back and see what are the immediate intervention which we need to intervene so that we can have a good quality, a quality data in Tanzania. That's one. But also, we were having a challenge of continuum of care. So that was the second priority in our country, to have a continuity of care. have all information of the patients so that we can provide the service to them, but also to track the availability, the all supply chain of the health commodities. So those are the priorities, the outcome priorities, which were guiding us to come up with the new investment roadmap, especially in the area of digitalization. But also, we were having the challenge of capacity within the country. We need our people to have a very good capacity in, as we know, the technology change today, day after day. So we were having a capacity gap. Now, through the investment roadmap, we were able to establish interventions which help us to build the capacity of the Tanzanian ICT people and Tanzania data quality and data people. So with that, we prioritize that intervention in our digital investment. But also, we know all over the world, we have a challenge of data use. Sometimes, especially in third world countries, we collect a lot of data, but those data are not used. So through the investment roadmap, we look at the intervention we see that they can help us to improve the area of data use in Tanzania. So basing on those outcomes, which are specifically in digitalization, but specifically to achieve the health outcomes, we are able to develop our investment roadmap. And that's why, while I was presenting the main achievement which we have already achieved during implementation of investment roadmap, apart from in the area of digitalization, but we are able to improve our budget preparation because of availability of quality data. We are able to track our health commodities. We are able to improve the area of data use from the facility level to the national level, because most of the data which were collected at the facility level, they were not used. So through the investment roadmap, we plan on how we can improve that area. But in the area of capacity building, we were able to reach a point where right now we are establishing the center, digital CDH, Center for Digital Health, where different expertise will come together and improve our system, maintain our systems. So those are the main achievements which we have achieved. But how we realize in that area, because when we were planning on, when we were developing the investment roadmap, we were looking at the outcomes which the government need so as to improve the provision of health services in Tanzania. Thank you very much, Neema.
Thank you very much, Mr. Macha. And since we are running out of time, I'll request our panelists to keep their response briefly so that we are able to respond at least all questions, few questions, if not all. Danielle, do you have anything to comment on that for a few minutes?
Sure, I actually saw a comment in the chat that I wanted to quickly speak on, and it's from Millicent, and she was speaking to the need to prioritize infrastructure development as a means of facilitating our progress towards, digital health and universal health coverage. And I really wanted to second that, because there are various levels to making digital health a reality and universal health coverage a reality through digital health, right? One, there's going to be that need for infrastructure, so we need proper internet connectivity. Persons need to be able to access it, which means, you need to put up the poles, the wires, all the different cell service centers, etc. That's going to be one. 2, the actual hardware and devices that people use. So, you know, the tablets, the computers, the phones, the laptops, 2 persons have access to that. Then there's another layer on top of it, which another person in the chat kind of put a question similar to it, which was, how are we ensuring that end users also have buy-in? And there's a 2-part component to that, where you look at, 1, does the general population believe that this is important and something that we need, which is a key objective of Transform Health in terms of boosting that advocacy for civil society groups especially, right? So 1, do they want it? But 2, do they also have the requisite, you know, digital literacy and know-how and, you know, being tech savvy, knowing how to then integrate this into their lives? So can they use an app? Can they use a phone that, you know, may have whatever digital app or so on that is helping us to achieve universal health coverage there? And if we're going to be implementing digital solutions for doctors and nurses that are on the ground, do they understand how to use a cell phone, how to use the requisite application, etc.? So there's a hardware, the literacy level, the infrastructure that is needed. There are many different levels that will need investment overall, and we do have to look at all of them. And again, all of that against the backdrop of building a country consensus and a population consensus, as well as a government and political consensus that this is something we need to move forward. Thank you.
Thank you very much, Daniela. And since we are running out of time, I request our panelists to just give few comment or closing remark for your response. And maybe I'll start with Dr. Mbo. Will you, if you can just conclude your speech? Thank you.
Thank you, Nema. Thank you, Daniel, and thank you very much. Je crois que c'est une des meilleures réunions que j'ai pu assister. Je vous remercie pour cette idée et cette opportunité que vous nous avez donnée pour échanger. Ce qui ressort aujourd'hui, c'est vraiment cette force que nous offrent ces processus à travers ces principes d'inclusivité et de participativité de toutes les parties prenantes. Ça nous permet de nous mettre tous autour de table et de définir comment nous comptons changer des choses. Et c'est très, très efficace. Je pense que c'est l'une des meilleures pratiques que nous pouvons noter aujourd'hui. Et deuxième chose, je voulais ici mentionner l'importance de cette coopération sud-sud et c'est surtout de cette cadre de collaboration que vous nous avez offert pour collaborer avec les collègues de la Tanzanie qui ont suffisamment de l'expérience dans l'élaboration de feuilles de route des investissements, mais également de voir comment on met en place des cas de collaboration avec ceux qui ont déjà de l'avance dans l'implémentation des solutions numériques dans leur pays. Et surtout, nous savons que la RDC, comme beaucoup de pays de l'Afrique centrale ou australe, présente les mêmes particularités, notamment en termes d'infrastructures, en termes de fractures numériques, mais également en termes de stabilité politique. Donc, nous pouvons mettre en place des cas de collaboration pour nous permettre d'apprendre des meilleures pratiques, mais également de nous soutenir mutuellement dans le cadre des formations ou des recherches en santé numérique. Ça nous permettrait d'avancer très vite sur nos différentes visions en termes de transformation numérique dans le pays où les ressources font défaut, mais où nous avons aujourd'hui l'avantage d'avoir tout le monde qui ont compris, au moins aidé par la pandémie de Covid, que le numérique peut évidemment combler le gap en termes de l'offre de services, mais aussi renforcer la qualité des services, mais aussi la qualité des données. Merci beaucoup à l'organisation, merci aux collègues, merci surtout à tout le monde pour la participation. Merci.
Thank you very much, Dr. Mbo. Maybe coming to Macha, what is the one thing that you will want us to take away from today's conversation? Macha.
There's a lot to learn from
At
this.
Least one thing.
One thing is we need to find an opportunity or a forum where we can share our experience, especially in these third world countries where we have reached in the area of digitalization. Because as you see, my fellow many panelists, they are in a different stages in the area of digitalization. So compared to Tanzania, and there are good things which they are having, which we don't have. We have some mileage we have gone, which they have not yet achieved. So I think my request to global partners to see how we can share these good experiences in the area of digitalization. And today, during this session of today, I have learned a lot, but the only thing which I come up with is the biggest thing which I've come up with is we need to learn and to share the good experiences which we have passed through during this digitalization. Thank you very much.
Thank you very much, Mr. Macha. Maybe as we are winding up, I'll give Daniela 1 minute. What is one thing that you like us to take from this conversation? Daniela,
definitely, I'd have to agree with Dr. Macha. You know, that importance of community and conversation is what's going to be important here. And, you know, with Transform Health being a coalition, bringing together all these different organizations and voices, that's essentially, you know, the backbone of Transform Health as a coalition. So I agree, we need more spaces to dialogue, connect, and we need to ensure that those spaces we create are inclusive and have our young people also lending a voice to the future of our digital health and universal health coverage overall. Thank you.
Thank you very much. And I will like to thank the panelists for joining us. I'm afraid that all the time we have today, I want to thank you, each of our phenomenal speakers, for their insight and dedication to advancing health equity. And for those you tuning from around the world, thank you very much for your participation and your thoughtful question. Unfortunately, we were unable to get all to them, but we hope you will continue to engage with us on our social platform. Whether path is new to you or you have followed our work for a long time, we appreciate you taking the time to join us today. Please stay in touch, and we hope you'll log in for future Path Live Forum. Thank you very much and take care. Thank you very much for joining our call. Take care.
Bye-bye.
Bye. Thank you very much, Macha, for joining.
Thank you. Thank you.
Bye, everyone.